One thing went through yesterday, Hippolito, we are usually now doing 2 or 3 cycles. We should have perhaps indicated from yesterday the change in terms of where we are going, but there's changes in terms of protocols and guidelines that are ongoing as we review the current data. So one thing we noted is that for the most part, the third batch of samples that are processed usually come out around 7 or 8. And then you have to be calling people, the positives at least, to reach them before we can release any infographic. And sometimes people don't give us the proper number, they give us somebody else's number, or they don't answer the phone. And so I think it's right that they are informed first, the positives, even though our infographic makes no indication as to who are the potential positives. I think it's important that we tell them. We don't routinely reach out the negatives. I mean, we have been delayed in that response, but shifting around some of our staff, what we have done is we have assigned 2 persons now to reach out via phone with the negative results. So because the process becomes too late at night to be handing out those results and then coming back to review the data, we have decided that what we'll do is we'll still go ahead and call out the persons who are positive on the day whenever we get the result. But so we can have a clearer picture to be able to present to everybody. We are now looking at presenting the data around midday every day.
There seems to be an increase of numbers of positive cases in Orange Walk. Is that a concern?
Yeah, but recall that we had anticipated that the clusters would have spread out in Orange Walk and, of course, the documented situation already in San Pedro. And we're still doing tests in San Pedro. I know it's not as quickly as people would want, but we're still doing that. We have actually started doing testing for people from the first cycles of San Pedro, that when the cases started to erupt there. I believe that from yesterday's sample, um, some were processed, but none had been recovered according to that definition. And even that is being changed in terms of how many negative tests you're going to do before you're considered a recovered case.